Welcome to County Connection, where we talk about events, programs, and services offered by Summit County government. My name is Julie Sutor, Public Affairs Coordinator for Summit County. We have a great episode lined up for you this month. We're going to be talking about protecting your home from wildfire, emergency preparedness for a public health crisis, and lots of other great topics. So stick with us for a great show. For our first segment of this June episode of County Connection, we're going to be talking about how our public health department prepares for an emergency. And here to shed light on the topic is Abbie Cobb, who is a regional emergency preparedness coordinator who works closely with our public health department. Welcome, Abbie.
Thank you. Nice to be here.
And we have Amy Wineland, who is the Summit County Public Health Director. Welcome, Amy.
Hi, Julie.
All right, so the two of you and your staff do lots of preparedness all the time, and it may not be the first thing that comes to mind with emergency preparedness. Lots of times people think about wildfires or floods or things like that, but public health actually has a really big role in emergency preparedness. So can you shed some light on that?
Sure. Well, certainly in public health, an emergency actually could be a natural disaster such as a wildfire or even widespread flooding. If we're looking at folks being able to return to their homes and doing it safely, we might provide tetanus shots, for example, if they needed to clean up the areas. But most commonly, we're talking about a disease outbreak, such as the 2009 H1N1 influenza outbreak that occurred.
Right.
And so disasters can actually constitute a major public health risk. And we prepare to respond to those in collaboration with all of our typical emergency response agencies and community partners. We develop with them and maintain plans and policies in how to respond to a disaster. And our specific role is really to prevent or lessen the devastating effects and consequences to human health in particular. And we do this by ensuring effective and proven public health measures that will prevent further death or illness or injury, disease, even economic disruption. And so, as we did during the 2009 influenza outbreak that we had, some of the roles we played in that was to disseminate educational materials throughout the community, even to our providers and residents on and about the illness. And then we were actually able to provide mass immunization clinics, which helped stop the spread of the disease as well. Right.
Okay. So, Abbie, can you shed some light as the regional coordinator, because you work with counties beyond Summit County? What is Colorado's approach to emergency preparedness on the public health front?
So Amy talked a little bit about the local preparedness response, and as a local public health agency, we also rely heavily on regional and statewide agencies to support us. The reason we do that is if we had a major public health outbreak in the county, we probably would run short on critical resources like public health professionals, medication, vaccine, supplies, etc. So we probably would need quite a bit of help on that. So the first thing we do is we would reach out locally to our other healthcare partners within the county and see if we can fill the needs that way. And if locally we can't do that, then the next thing we do is reach out regionally to our partners in Northwest Colorado, which is our region. And I am part of a group of regional emergency preparedness and response coordinators throughout the state. A number of us work within the Northwest region, and we actually assist local public health agencies in advance of an outbreak by developing plans, procedures, exercises, trainings, anything that's needed to be better prepared. The last 5 years, the major focus for public health has been preparation for a major disease outbreak, and we've seen what's happened with Ebola and Zika, so there's really an importance for that. And then as the incident would continue to grow, we then reach out statewide to other regions and state agencies. And then if we still didn't meet all of our needs statewide, the state would reach out to federal agencies like the CDC, something like that. So the reason that we're talking about all this goes back to an exercise series that started in 2016. And in early 2016, we did a statewide exercise. We all did it on a local basis that was focused on how do you handle a sudden outbreak locally of this was a respiratory, highly contagious respiratory illness. And we worked on that locally to figure out how we would coordinate and communicate with each other. And that actually led into what we're doing now. So we looked at our responses and our plans and procedures and updated plans based on the feedback and the pros and cons that we identified in 2016, and some equipment if we needed that. And now we're moving forward to the next step, which is another statewide exercise. This one is coordinated by the Colorado Department of Public Health and Environment, the CDPHE, but it's being conducted locally with local public health agencies in every county in the state, as well as hospitals, clinics, anybody who wants to play. So what the focus of that exercise will be, it's actually a 3-day exercise, June 15th through the 17th. The first 2 days being sort of smaller scale than the third day. And the first day will actually kind of be a continuation of the 2016 exercise, and we'll be identifying what resource shortages we have in the county, working with our local partners to fill those resources, and then moving on and submitting resource requests to the state. That's Thursday, June 15th. June 16th will actually be receiving equipment and resources that we order, and then deploying them within our county. And the big day actually is June the 17th, and I'm going to let Amy talk about what Summit County will be doing on that day.
Okay. Before we talk specifically about the 17th, can you talk about maybe what some of the biggest challenges are that communities face when they are confronted with a crisis, and why, I guess maybe some of the points that you're really focusing on in this planning, where it takes a community, whether it's resources or certain planning to get over certain challenges or humps when they're confronted with a crisis like this.
Well, I'll let Amy answer this too, but from my point of view, one of the big pieces, especially in a more rural area, is the resource piece. The people to deal with the pod or whatever kind of treatment we have to work with the public on, the lack of medication and where to get it and that sort of thing. So I think resources is one of the biggest things that we have to deal with.
So then how do you ramp up quickly to be able to handle a workload that you never see on a day-to-day, kind of in your daily work?
And that's where it's really important to have other partners involved, because there's no way we can do it by ourselves. And sometimes even regionally and statewide, if it's really big, it's hard to do. So.
All right, so, and hopefully practice makes perfect.
Close to perfect, near enough.
Can always do better.
Yeah.
So Amy, let's talk about the third day of this exercise where you're kind of practicing these systems and ramping up the resources.
Right, so in the first couple of days, we're really, as Abbie alluded to, we're going to be ordering from our strategic national stockpile. The scenario is that we've run out of medication in this instance for a disease outbreak, and so we are calling and placing those orders at the state level and actually at the national level. And so that medication gets distributed through regional points of distribution, and then it comes here locally. So that's happening on the first couple days. And then actually, as part of the statewide exercise, we have decided to stand up a drive-through point of distribution, or POD, it's called. And exercises such as these are really critical to be able for us to prepare and test our plans that are already in place in the event of a true disease outbreak. To be able to distribute life-saving medications or any medical countermeasures that would be
can you explain
needed.
this pod concept a
Sure.
little bit more? So if we were to experience a really widespread outbreak in our community, our kind of the existing ways of doing business wouldn't be sufficient, right? So then, so you kind of set up this new organization, not from scratch, but
Sure. Yeah.
So what does that all look like?
Yeah. Well, the benefit of doing a drive-through pod, it's the concept of a drive-through. So it's not any different than you drive through any of our conveniences that have been stood up. Like we have drive-through pharmacies and drive-through coffee and drive-through, other sorts of food. So we're used to that concept of driving through. And so the benefit of doing a drive-through point of distribution is really, it allows us to maintain some social distancing. When we're talking about an illness, it helps us keep sick people away from healthy people. It helps protect the staff and keep them safer, so that they're not as exposed as they would be within a building or a clinic, for example. It also allows our county residents and visitors, if it were to, we would be including anybody who would need these measures, that they could have their needs met while they're waiting in the comfort of their own car. And so the concept is that they would come through an area where they're first filling out paperwork. It could be questions about if they're allergic to medications, or that we're trying to understand what types of medicine we would be able to distribute to them.
Okay.
And then they go to the next stage where that screening is finer tuned. If they have medical questions, we have a medical officer where questions could be asked before we're actually dispensing the medication to make sure everything is as safe as it can be. And then they go through the third step, which is where they actually get the medication. And then they drive away, so they never actually have to leave their vehicle. And it's a way that we can efficiently distribute a large amount of medication, as opposed to people parking, coming into a building and leaving. It also can be done more efficiently with less staff.
Okay, great. So then, in order to be able to fully practice this, you need the help of the good folks of Summit County.
That's right.
We absolutely do.
So how can folks help you help them?
Sure. So the success of this exercise is dependent on participation from our community. And so individuals who are willing to help us practice can serve us by pretending to be a patient and driving through our point of distribution, filling out some forms. No individual or real data is going to be collected. And then they would come through and actually, instead of medications, we're going to be distributing different types of candy depending on the type of medication they would need. And in order to hopefully encourage more participants, we're also going to combine it. We're partnering with the Sheriff's Office, and we're going to be doing a drug take-back event as well. So at the end of our point of distribution line, at the end of the drive-through, there will be an opportunity for folks to give us their unwanted medications and prescription drugs.
Great, and we've talked about that issue on County Connection before, just the importance of both for our water quality as well as protecting against abuse or misuse of pharmaceuticals, to get all those old medications out of your medicine cabinets and dispose of them safely, not down the drain, not in the toilet, but through one of our methods where we know it's going to be safely disposed of and not pose any problems for the environment or for diversion. Right. So great. Well, Abbie, anything else that you'd like to add about the exercise coming up towards the middle of June?
No, I guess I would just encourage all citizens and visitors in Summit County to drive through. You know, it could take 10 minutes, it could take a half hour, but you can stay in your car, and as Amy said, it's a much more efficient way to move a larger number of people, and people like to be in the comfort of their car, so hopefully all of you come on out and help us.
All right.
It's going to be on the 17th, as we mentioned, and it will
Which
take
is a
place.
Saturday.
It's a Saturday, right? June 17th. It's the same day as the Frisco barbecue, so you could come help us out from 9 to 11, and then head over to Frisco for some good barbecue.
All right.
And it'll be taking place at the Summit Stage Bus Barn, which is backed by the County Commons.
Excellent. Okay, so 9 to 11, and you don't have to be there for the full 2 hours. It should
Certainly
take
not.
10 or 15 minutes maybe, depending on the line of cars.
Exactly.
All right.
Dogs. Talk about dogs.
Great. Well, we'll hope to see lots of you there. And thanks, ladies, for stopping by and letting us know about all this great work you're doing to help Summit County prepare
Thanks, Julie.
for a bad day.
Yeah. Thanks, Julie.
Thanks,
Appreciate
Julie.
it.
All right, stick with us. We're going to take a quick break, and when we come back, we're going to be talking about the Summit County Chipping Program, a free opportunity for you to protect your home from wildfire.